So the final category that we're going to talk about is knee pain with no injury. And this is probably the most common category of people that I see in my office. With no injury, you can pretty well eliminate some of the more serious problems. It's unlikely that you have a fracture. It's unlikely that you've torn your ACL. It's unlikely that you've got any of those things that require immediate care. So without an injury, you can treat this for as long as you feel comfortable. You can take anti-inflammatories like Motrin, Advil. You can even add some Tylenol if you need to for additional pain relief. You can wear a knee sleeve or even something a little bit more substantial to give your knee some support. And you can modify your activities. But it's important to realize that there are a couple of different categories of problems that we see that kind of fall into this 3-category system that we're talking about now: injury, minor injury, no injury. You can have an injury where you've damaged something. Something's torn or broken, and in that setting, the body has program systems in place to heal those injuries. So with time and the right treatment, that sort of problem should get better, heal, and you can get back to normal. The second category is overuse injuries. So you didn't have anything that was severely damaged, but you've overdone it. So this is kind of like going to the beach and getting a sunburn. You were out in the sun more than you should have been. Your skin is reacting to that. You're miserable for a few days, but then things settle down and everything's back to normal again. So with an overuse injury, sometimes it's a new exercise that you've taken on. So you didn't have an injury per se, but you're doing something now that you didn't used to do. Or it may be that you've changed jobs and now you're working in a retail setting where you're standing on your feet all day long. Or you work in a factory where you're walking around on concrete. It could be that you moved into a new house and now you've got stairs that you're having to deal with on a regular basis, or that you've put on a few pounds over the years, not being as active as normal, and that's starting to take its toll. So all of that is overuse. Well, with overuse, if you can identify what's aggravating the problem, then you can address that. So if it's a particular exercise, maybe you just back off on that. If it's the work environment that you're in, maybe you get better shoes, arch supports, or you ask your employer if you can modify something about your workspace to help take some strain off of your knees. Overuse injuries can be treated as long as you understand what the problem is. Sometimes the answer is physical therapy. By doing physical therapy, you strengthen your body so that it can handle this stress now. So even though you might be having pain and you think, well, overuse means rest, again, that's a fairly passive approach to managing it. If you only rest and you don't do anything else, then when you try to resume that activity again, your body's still not able to handle it, and so you're going to be limited or you're going to have symptoms again. So therapy is a way of strengthening your body to prepare it for this activity that you want to be able to do. So that's category 2, so overuse. Category 3 are the wear and tear problems. Unfortunately, with regular use, over time, things start to break down. And parts of our body break down as well. Now, fortunately, our bodies are capable of healing, but sometimes the wearing down process happens faster than the healing process. And so this wear and tear just accumulates slowly over time. So it's possible that you've just gotten to a point where things are not able to handle the stress that you're subjecting them to, and that's going to be the case no matter what you do. Unfortunately, a lot of people get stuck in that category when they shouldn't be. So they might be told that they've got arthritis, and they're given a prescription, and that's all that is recommended, and so then they're stuck either taking this prescription indefinitely or not being able to do what they want to do because every time they do, it makes their knee hurt. So there are problems somewhere in between this injury and overuse and wear and tear. And those are the problems that, as an orthopedic specialist, I can help with. So what do we do for those sort of problems? Well, again, initially, the first thing that we recommend is a short course of some oral anti-inflammatories. So that could be over-the-counter stuff like Motrin or Advil. Take it every day. If this has been an ongoing problem for a while, then I might suggest a month initially. Now, again, you have to be careful about taking anti-inflammatories because they can cause some problems if you have certain medical conditions or if you're taking certain medicines. So as a bonus for this program, I've included a video where I go into a little bit more detail about anti-inflammatory medicines and how you should use them and what you should be cautious about. So if that's something that you're concerned about, then you should watch that other video, and I think that will help you figure out if that's going to be the right thing for you. But in addition to the anti-inflammatory medications, sometimes we need to do something that's a little bit stronger than that. And I'm not talking about narcotics. We really don't recommend using painkillers, narcotics, for problems that we don't expect to get better quickly. So like a broken bone or someone that's had surgery, we'll use narcotics for a few weeks to help them get through that process. But for something that's been long-standing, narcotics is really not a good choice. But what does work well is cortisone injections. Cortisone is an anti-inflammatory that your body naturally makes, and it's very potent. And when we put cortisone at the site of a problem, it can be very effective. It can help reduce the pain significantly. It can help reduce the inflammation significantly. And sometimes a single cortisone injection may resolve a problem. There's a misconception out there, and I'm not sure where people get this idea, but there's this misconception that once you do a cortisone injection that you have to keep going back to get multiple cortisone injections, and then you're kind of stuck in this, revolving door of injections. And that's absolutely not true. Oftentimes I'll see somebody and we'll do one injection and they're better and they don't come back anymore. They don't need any more help. There are some cases where we will do cortisone injections periodically if the symptoms return, but that's not always the case. The other misconception that I hear people talk about regularly is that cortisone's bad for you. Well, just like anything else, too much of anything can be bad for you. So we don't recommend getting a cortisone injection every week just so you can keep doing your weekend sports. That's not a good idea. But if you get a cortisone injection and 6 months later you do something else and aggravate it and get another cortisone injection, there's nothing wrong with that. That frequency is not enough to cause any real problems. So I wouldn't be afraid of it. Now, some people are a little skittish about getting a shot and needles and that sort of thing, and that's fine. You don't have to do cortisone, but it's just another tool that we have that can really help. The third option is wearing some sort of a brace. Providing support and protecting certain areas from stress can be beneficial. Now, the use of a brace is not always ideal because they're awkward, they're uncomfortable, especially I live in the South, it's hot here, and that may not be what you want to do. But if it hurts every time you play golf and you really want to play golf, then just wear it when you play golf. You don't have to wear it all day, every day. But if you like going to the gym and doing CrossFit, but your knee hurts, wear the brace when you go to the gym. You don't have to wear it at home. You don't have to wear it to work. But now, if it hurts every day, all day, no matter what you do, then wearing a brace all day, every day may not be that appealing. So the use of a brace may depend on your individual situation. And then physical therapy. That's another tool that can be very helpful for knee pain. And a lot of people struggle with this idea because their thought is, well, if it hurts when I do X, Y, and Z, then why would I go to therapy and have them make me do X, Y, and Z? Well, that's not really what therapy should be. Now, unfortunately, some therapy places are like that. They just have a recipe and they're going to plug you in and tell you to do these things. And if it doesn't work, then they're just, oh, well, we couldn't help you. Good therapy should not be like that. A good physical therapist should assess you, figure out what you can and can't do. And a lot of times, one of the things that underlies some of these issues, especially if you've been dealing with a problem for a long time, is movement problems. Sometimes the knee's stiff. It doesn't come all the way out straight, or you can't bend it far enough. Sometimes it's weak and you just don't have the strength to move properly. And by identifying that and working on regaining that strength, you can improve those movement patterns. And you improve your movement patterns, things feel better. You can do more without aggravating your knee, and overall it just helps. The other aspect of physical therapy that we know to be true is that the quad muscle, the muscle on the front of your thigh, is a shock absorber for your knee. And when your quad is weak, your knee has more stress on it. That makes it hurt. You tend to be less active when your knee hurts, your quad gets weaker, and you get into this vicious cycle, a downward spiral. If you can break that cycle, get the quad stronger, it's a shock absorber, it takes stress off the knee feels better, you can tolerate activity better, you can do more exercises to get stronger. So quad strengthening exercises are a big part of physical therapy for a knee problem. But sometimes doing those exercises is difficult. It can hurt the knee whenever you do them. If you try to do it on your own, most people's tendency is if it hurts, don't do it. Well, that's not always the best strategy. Sometimes if it hurts, we need to treat the pain so that you can do it. And then once you get stronger, then it won't hurt anymore. So sometimes there's a balance between what the doctor does with prescriptions or injections or bracing and what the therapist does with exercises and stretching. And we have to work together to try to help get you past the point where you can do things without pain anymore. So that's kind of a big overview of how we manage knee pain. But if you're dealing with this and you have been for a while and it's just not getting better, don't just sit on it. Don't just accept that this is your fate and that you're never going to be able to do whatever again. Get it evaluated, get the help that you need, and get back to living the life that you want.